Hey everyone, and welcome back to another video. I'm sure you can tell this is a bit of a different format, and I'm not really going to be going crazy with the editing here. This is mostly some notes that I made while talking with clients and also just looking at what I do. So yeah, let's just get right into it. I'm going to be reading from the document, and hopefully you guys can follow along. Also, this is not medical advice. I must say these are just notes that I took based on what I do, based on some of the clients that I've talked to, what they do, and also based off some of the research that I've done. So, I'm not a doctor. Go talk to a doctor, and yeah, that's the end of that disclaimer. So, yeah, do your research, whatever. So, mostly this is going to be concerning finasteride and dutasteride. So, finasteride, taken orally at a dose of 1 milligram daily. Dutasteride, initially taken orally at a dose of 0.5 milligram twice a week for 4 months. From there, taper up to either 0.5 milligram dutasteride every day or progressively titrate doses up to 2.5 milligram dutasteride if that is the desired goal. Alternatively, 1 milligram of finasteride daily for a duration of 3 months during the same time period, right? 0.5 milligram of dutasteride daily. After the completion of 3 months, discontinue the use of finasteride and just use dutasteride. So you're using 1 milligram of finasteride daily along with 0.5 milligram of dutasteride daily during the same time period together. So over here, note 0.5 milligram of dutasteride and 1 milligram of finasteride have similar sexual side effect rates. However, 2.5 milligram dutasteride has a bit more. So if you look at this chart over here, this is from the EPICS Enlarged Prostate International Comparative Study, and the data is from GSK. So we can see that when we're looking at the side effects over here, you can see that dutasteride tends to have a lower side effect rate than finasteride, slightly lower. So you probably see that, oh, this thing mentions 5 milligram finasteride. One thing that people have to understand is that unlike dutasteride, finasteride is not dose dependent. If you go above 1 milligram finasteride, you're not going to see more suppression of systemic or scalp DHT. You're just not going to see more of that. So effectively speaking, 5 milligram finasteride is the same as 1 milligram finasteride when it comes to treating androgenetic alopecia. So there's that. I kind of just burnt right all through that. So hopefully that knowledge can be retained. But let's keep going on to the next part of the document. So this is a quote that's from the phase 3 dutasteride clinical studies, or could it be phase 2? It's from one of the clinical studies for dutasteride in regards to androgenetic alopecia. I'm not going to read the whole thing. Essentially, it says that what the researchers observed was that dutasteride had lower sexual side effects than finasteride, and it kind of parrots other studies as well. So there's that. It only had greater sexual side effects at 2.5 milligrams a day of dutasteride, so that's something to be mindful of. Starting with finasteride is important. That is the thing that most men should do if they have androgenetic alopecia. Start with finasteride right away. You don't even have to worry about minoxidil, especially depending on what NORAD you're at. Start with finasteride just to slow down, halt, or even reverse androgenetic alopecia, because you have to deal with DHT, and at least be on finasteride 1.5 years to 2 years before you consider dutasteride. Now we're going to walk through this as we go along with the video, that kind of thinking. So there's this quote or some sort of sentiment that I see a lot. It's like, help, I'm losing like 1 million hairs a day, what do I do? And this typically happens when people are on treatment. So the answer is nothing, continue treatment. People have to be very patient in order to see progress with their androgenetic alopecia while using finasteride or dutasteride or any hair loss protocol that works. You have to be patient. Hair doesn't just manifest and grow out of nowhere like in a second. It takes time, it takes multiple growth cycles to see things fully improve. Now, you have to ask yourself this question. Are you below baseline? Baseline is the point before you started treatment. So is your hair below in terms of aesthetics and hair count? Is it below the point you started treatment? And if the answer is yes, I am below the point where I started. If you've been on treatment for less than a year, stop complaining and push through it. You're literally shedding. If you're observing that your hair's falling out after 5 months of using finasteride or a month or whatever, this is a shed. People below this out of proportion, and you see comments where people are like, it's not working, I'm still shedding, I'm even shedding more hair. It's like, you do realize, in order for your hair follicles to grow stronger hairs, they have to let go of their current ones that are weak to make way for new, stronger ones. So it's like, people need to do themselves a favor. Go look at an animation timeline of hair and how it grows naturally, right? It's probably even slower for miniaturizing or miniaturized hair. Let's keep that in mind, and let's temper our expectations, and first be more patient. That you in order to see any sort of progress, you have to have time. Don't rush things. Now, if you've been on treatment for more than a year, ask yourself, did you stop or add any new treatments? Typically what I see is that you have people throwing in like topical minoxidil willy-nilly, using it for 3 months, stopping, then wondering why they're shedding. They're starting a topical anti-androgen treatment like the experimental RU58841, KX826, or CB0301. They like to mess around with these things, use it for like 4 months, stop, use it for 8 months, stop, use it for a month, stop. It's like, you have to be consistent with what you use. Stop adding things and removing things. Stick with one thing for a solid year to a year and a half. Don't add anything else in. If you can't commit to using topicals, use like Finasteride. Just stick with Finasteride. The most basic thing you can do is just use Finasteride. Don't even worry about minoxidil, but just use Finasteride. But more importantly, it's about, the message should be, don't be so inconsistent with your protocol. Be consistent with whatever you pick and choose to do. Now, there is a phenomenon that many people do not know when it comes to shedding, and it's called synchronized shedding. And this occurs when you start treatments like Finasteride or Dutasteride, and when you start these treatments, right, here's what happens. A large amount of scalp DHT is suppressed. I think with 1 milligram Finasteride, you're suppressing about 40% scalp DHT. With 0.5 milligram Dutasteride, you suppress 50% scalp DHT. And going all the way up to 2.5 milligram Dutasteride, you suppress 80% DHT. Now, this causes the hairs that were being affected by DHT to essentially free up and start growing into a new growth cycle, and they do this all around the same time. And because they're kind of synchronized in the time they grow together, they will eventually shed at the same time and fall out, right? They'll fall out at the same time, so you may see a big shed in the future where a lot of hair just seems to fall off, and in this time period, you may notice that you're well below baseline, and you may say, well damn, Finasteride or Dutasteride stopped working for me. When in reality, although the shed is jarring and probably scary, it's a good thing that it shed a lot of hairs. That means you had, first off, you had a lot of hairs that were sensitive to DHT, and second, that means when the hair starts to grow back, you'll get stronger hairs in more sites based on how much shedding you had, right? And yeah, this reasoning is mostly from Merck Research Laboratories in one of its studies, so I'll actually continue on to read that real quick. So this is the quote from their study. So quote, based on the predefined endpoints utilizing photographic methods, hair counts, and global photographic assessment, peak efficacy was observed at 1 to 2 years of treatment with Finasteride. This observation of an apparent peaking effect is likely due in part to the previously reported beneficial effects of Finasteride on the hair growth cycle based on phototrichogram study. In that study, initiation of Finasteride treatment was shown to increase the number of anagen phase hairs and increase the anagen to telogen ratio, consistent with the normalization of the growth cycles of previously miniaturized hairs due to the release of hair follicles from the inhibitory effects of DHT. Consistent with these results, Finasteride treatment was also shown to increase the growth rate and/or thickness of hairs based on analysis of serial hair weight measurements. Because these beneficial changes in the hair growth cycle are dependent on when therapy with Finasteride is initiated and occurred rapidly, the affected hairs are driven to cycle in a synchronous manner. If these hairs have somewhat similar anagen phase duration, they would enter the telogen phase as the anagen phase and catagen phase, and followed by subsequent shedding in a partially synchronized fashion. This would be expected to produce a gradual decline from peak hair count after a period of time equal to the average anagen phase duration. Eventually, as subsequent growth cycles recurred, these hairs would be expected to become increasingly independent thereby losing their synchronous character as their growth cycles further normalized over time, leading to a sustained increase in hair count at a plateau above baseline, as suggested by the 5-year data presented here. Merck Research Laboratories 2002, unquote. So, again, to reiterate, it's saying when you remove a large amount of scalp DHT, the hair follicles that were affected and being suppressed by DHT, suddenly they're like, whoa, okay, now we can all grow now, and they're all going to grow at the same rate, at the same time, given that they have similar anagen phase. So it depends at what phase these hairs are currently in their current cycle, but the bottom line is some of these hairs will become synchronized and they'll grow at the same time, and then eventually sometime down the line they'll shed at the same time. And you can have different parts of your scalp synchronized at different time points. The bottom line is this, right? Shedding is to be expected in both people who have androgenetic alopecia undergoing treatment, people who don't have androgenetic alopecia, right? Shedding is just your hair follicle's way of letting go of new hair. Now, it's what happens after that shedding. And what you must be rest assured, right, is that as long as you're on treatment, and as long as you're suppressing that inhibitory effect of DHT and the presence of DHT in the scalp, you'll be fine. It's scary, right, that you're probably shedding a lot, you'll be fine. And also consider this, right? If you're using Dutasteride, which is 0.5 milligram to 2.5 milligram, you have a scalp reduction range between 50 to 80%. That's probably going to cycle a lot of the hairs to kind of shed at some point at the same time. So you may get severe shedding while on Dutasteride. Don't listen to those people who complain and say that Dutasteride ruined my hair and it'll never get better again. And then they switch to Finasteride, and it's like, dude, you have to give it more time. And a lot of these people just don't supply pictures, and when they do, I'm just like, dude, whatever. Like, it looks fine. But we'll cover on like some dosing protocols later that could possibly explain why that may be the case. So let's look at the next part of the document. So one could switch to Dutasteride to come out of a shed quicker if you are below baseline. So no, again, reiterating, Finasteride did not just stop working, you likely aren't patient enough to come out of a shed. And if you don't want to switch to Dutasteride, if you don't want to go to Dutasteride, just wait while taking Finasteride to see what happens with your hair. Now, no, if you're not below baseline, then just, I don't know why you're here. Just keep using the treatment, you'll be fine. Now, there is a Dutasteride dosage adjustment plan. So we're going to look into this now. The frequency of Dutasteride intake should be increased every 2 weeks by an additional 0.5 milligram per day. Now, this is for people who are trying to taper up to 2.5 milligram a day, or if people who are trying to go from using Dutasteride twice a week to Dutasteride every day of the week, right? So we'll look at it a bit more. The tapering up of Dutasteride can be done either by taking 0.5 milligram daily or by taking 2.5 milligram daily. So you can just jump right into it if you're ballsy, 2.5 milligram a day, or just go right to 0.5 milligram a day. Then you also have 1 milligram of Finasteride daily for a duration of 3 months, and at the same time, 0.5 milligram of Dutasteride daily for also a duration of 3 months. So you're kind of using both 1 milligram Finasteride daily, 0.5 milligram of Dutasteride daily, again at the same time. Now, after the completion of 3 months, you discontinue the use of Finasteride and just use Dutasteride. Now, Dutasteride loading phase. This phase is particularly relevant for those transitioning from Finasteride to Dutasteride. Initial loading. Begin with 2.5 milligram of Dutasteride daily for 1 month. This rapid introduction is designed to quickly achieve a steady state concentration of Dutasteride in the body. Now, what is steady state? Let's give like a normie layman kind of explanation. So steady state. Achieving a steady state is crucial for the drug to have consistent effects. In this context, it means effectively reducing DHT in the serum and scalp. Steady state is a term commonly used in pharmacokinetics, the branch of pharmacology concerned with how the body absorbs, distributes, metabolizes, and excretes drugs. When a drug reaches steady state in the body, it means that the rate of the drug administration equals the rate of the drug elimination. In other words, the amount of drug going around in the body is balanced by the amount being processed and leaving the body. This results in a consistent, stable concentration of the drug in the bloodstream and also the tissues. So, in simple terms, steady state means the amount of a drug in your body remains consistent over time. It's achieved when the rate at which the drug is taken equals the rate at which the body gets rid of it, leading to a stable, effective level of medication in your system. There is this thing that because dutasteride has a long half-life, and depending on the dose of dutasteride you're trying to get to, so 0.5 milligram of dutasteride typically could take around 3 months to start having a consistent effect on your DHT levels in your scalp and also in your serum in your body in general. And at 2.5 milligrams, it has been shown to, in theory, if you take it every single day for 1 month, it could have a quicker effect. But here's the thing, if you're using 2.5 milligram daily for a month, although you will reach that steady state sooner, right? Because you're overloading your body with dutasteride, and you'll slightly be at an elevated risk of side effects because 2.5 milligram of dutasteride has higher side effect than 0.5 milligram dutasteride and 1 milligram finasteride. So that's something to keep in mind. But also, you're reducing your scalp DHT during this time period by nearly 80% because you're on 2.5 milligram dutasteride. So there's a little bit of like kind of messing around here, right? Now here's the issue. If you immediately, it is conceivable theoretically that if you immediately switch from finasteride to dutasteride, it takes 14 days for essentially finasteride to kind of get out of your system. And in this time, once it gets out of your system, your DHT levels are coming back to normal, right? Now, it could be conceivable that during the time it takes for dutasteride to start working, which is anywhere between 1 month to 3 months, right? Depending on the dose, that let's say it is that 3 month, duration, that until you reach a consistent suppression in scalp DHT and serum DHT, it could be that during the time you discontinued finasteride, something wonky could be going on where scalp DHT levels go up, and that could cause a bit of a disruption in your scalp environment. Maybe not enough, maybe enough, who knows, but it could be enough to cause a shed in and of itself. And then finally, once your body and your scalp starts being consistently suppressed with dutasteride, you could get another shed on top of that. So that's at least my thinking when it comes to people who talk about having a severe shed while on dutasteride. You have to ask some questions. How did they switch from finasteride to dutasteride? Because it could be, for some people, that hang time in switching from finasteride to dutasteride causes that sort of severe shed. And then, further on top of that shed, the switching shed between finasteride and dutasteride, it's that how much milligram of dutasteride are you using? If it's 0.5 milligram, then you're looking at 50% reduction of scalp DHT. If it's 2.5 milligram of dutasteride, you're looking at 80% reduction of scalp DHT, which in and of itself is enough to cause a shed. So that is my take on the whole shedding phenomenon. And if you look over here, when it comes to the efficacy category, this is just another quote from the dutasteride clinical trials for AGA. And it says, in subjects whose serum DHT was not within 25% of the baseline value after 36 weeks, serum DHT was measured at approximately 2 month intervals until levels had returned to within 25% of the baseline value. Serum DHT returned to within 25% of baseline in a median of 86 days after treatment. So the range is typically 71 to 307 days for the dutasteride 0.5 milligram group, and in a median of 155 days, a range between 72 to 421 days for the dutasteride 2.5 milligram group. So basically, we're looking at how long does it take for your DHT levels to go back to normal after you discontinue either using 0.5 milligram dutasteride or 2.5 milligram dutasteride. And it looks like we're working with the values of 86 days for 0.5 milligram dutasteride and 155 days for 2.5 milligram dutasteride. But again, you can see that there's a range, a pretty wide range, right? But it looks like the median values are both 86 for 0.5 milligram and 155 for 2.5 milligram dutasteride. And then there's just a bunch of other quotes over here that I included in the document. Scalp DHT concentrations in the dutasteride group were also significantly suppressed with placebo in a dose-related manner. So this means the more between 0.1 milligram dutasteride up to 2.5 milligram dutasteride, you see a dose-dependent decrease in scalp DHT and also increase in scalp testosterone. And you also see with finasteride, it typically is just 1 milligram finasteride that has that suppression of DHT. It doesn't matter if you go up to 5 milligram of dutasteride, there is no dose dependency. So I'm not going to read all of these quotes, but I will try to include a link where you can read this document that I made so you can just see what I'm citing to make my rationalization. Dutasteride effectiveness in lowering DHT. Olson et al. Study mentioned serum DHT levels over time. Again, over here, in subjects taking dutasteride 0.5 milligram and 2.5 milligram, serum DHT returned to within 25% of baseline levels in a median of 86 to 155 days respectively. And this also shows how long of an effect that dutasteride has in lowering DHT levels once it reaches that steady state, right? Once there's enough dutasteride in the system, dutasteride will have a longer presence and a suppression or inhibitory effect on 5-alpha reductase, and also a continued suppression of DHT for quite a while, I would say. So scalp DHT was significantly reduced in the groups receiving dutasteride, oral dutasteride by the way, in a dose-dependent manner. And I mentioned this before with the figures. Again, you can look at the document. I'll try to put it in the description, but it'll tell you like for what dose, what can you expect in scalp DHT suppression. And we know that there's a correlation between scalp DHT and hair growth, and it's an inverse correlation between the change in scalp DHT concentration and hair growth. So as DHT decreases, the hair count is supposed to increase. And this is supported by various assessments: target area hair count, panel assessment of the vertex, investigator's assessment, photographic assessment, blah, 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 whatever. And yeah, you can see it in the clinical dutasteride trials for androgenetic alopecia. We're at this new category, transition from finasteride to dutasteride. So this is like a sort of protocol. So duration to steady state, right? How long will it take for us to reach the steady state? Now the steady state is, again, the amount of drug that exists in your body that can consistently suppress or have a so-called consistent effect in your body, right? So for 0.5 milligram of dutasteride, if we want to reach that suppression of scalp DHT by 50%, right, we need to be on dutasteride 0.5 milligram for X amount of days, X amount of weeks, X amount of months to reach that consistent suppression, right? It's not just after one pill of dutasteride or gelatin capsule. It's after several doses to reach a steady state. And in some studies, it shows it may take up to 3 months for dutasteride to reach that steady state in some people. Now, people are different. Some people have different metabolism rates, or metabolic rates, sorry, than others. So obviously there's a range and it varies between people, but just keep in mind that it's typically 3 months. Scalp DHT rebound theory. There is a theory that an immediate switch from finasteride to dutasteride could cause a temporary rebound in scalp DHT levels as the presence of finasteride wanes in the serum. This rebound effect is still theoretical, with some research suggesting it takes 14 days for DHT levels to normalize after long-term finasteride use, and, quote, patients receiving treatment for androgenetic alopecia have a reversal of hair count within 12 months. Zito 2002. Right? So return to baseline. Again, how long does it take for us to return to baseline while on Dutasteride? I already mentioned this before, 86 to 155 days. Shedding phenomenon. Again, we already just covered this. Again, with the brutal shed, depending on the dose of Dutasteride and how many of your hair follicles are sensitive to DHT, you could see a crazy ass shed sometime in the future or now. Maintenance phase. So after the initial 30-day loading phase of 2.5 milligram per day, maintenance can be carried out with either 0.5 milligram or 1 milligram of Dutasteride daily. This maintenance dosage should be sufficient to keep serum DHT levels as well as scalp DHT levels adequately lowered. Again, we also have, where you can look in the beginning of this video, you have people using 1 milligram finasteride and 0.5 milligram Dutasteride for 3 months, both together every single day. And then after 3 months, discontinuing only finasteride and continuing that 0.5 milligram Dutasteride from there on out. That's also another dosing protocol that I've seen online. You also have people that take 1 milligram finasteride daily and introduce 0.5 milligram Dutasteride once a week, or you also have people that take 1 milligram finasteride daily and introducing 2.5 milligram Dutasteride twice a week. Right? So those are some things to look at. So now some general notes on hair shedding revisited. Hair shedding is an inevitable part of the treatment process and cannot be completely avoided. The aim should be to expedite recovery from shedding by continuing the treatment, specifically using 2.5 milligram daily dose of Dutasteride during the initial phase, the loading phase, for 30 days, like I mentioned before, and then carrying on with that 0.5 milligram Dutasteride maintenance. There may be a synchronization of scalp hair growth, potentially leading to future shedding events, as noted in some studies with finasteride use. So hopefully this kind of like rundown, this verbal diarrhea that I came up with, helps people. Again, this is kind of like a draft. I put this together after talking to various people, doing my own research and looking at what I do. So yeah, hopefully this does give some people some guidance to look at what they can research to help themselves. And obviously, I'm not a doctor. Please do reach out to one and see what they think, and then proceed from there. So yeah, I'm done talking. I bit my tongue like 15 times during this video, but thanks for watching, guys, and I hope to see you in the next video. Peace out.